We are here to talk about patient safety, and it's the Patient Safety Awareness Week. So as we come together today with a shared commitment, and that is the enhancement of healthcare systems to improve patient care and outcomes. So it is important that we have this discussion. And as today's theme is on patient engagement, and patient engagement is at the heart of patient safety. And therefore, it plays a critical role in achieving our goal of providing quality and affordable healthcare to all. It is something that as an organization, we are keen and we'll do an introduction of what MedSource does in a few minutes. But before we do that, I would like to welcome all of us to this meeting. I want to extend my gratitude to all of us who joined to the MedSource Group. Sorry, I'm told somebody can't hear me. Am I audible enough, Anne?
We can hear you, Michael.
Okay, thank you. Thank you, David. So today we are going to explore the multifaceted concept of patient engagement. We're going to discuss its importance, its challenges, and what are the best practices in this space. So our aim is therefore to inspire innovative ideas, spark meaningful discussions around patient care, and ultimately to drive positive change in the healthcare landscape. So today I would like to encourage all the participants in this session to actively engage in this dialogue, submit your questions, comments, and let's therefore collectively harness the wisdom in this virtual room and make a lasting impact on healthcare. So without much further ado, I would like to invite the CEO, MedSource Group Limited, to give us a brief introduction of what MedSource is, what MedSource does, before we go to the next stage. So join me in inviting our CEO, Mr. Vinod Gupta, to give us a brief presentation on MedSource. Karibu, Mr. Vinod.
Thank you, Dr. Michael. Patient safe, optimal. Allow me to presentation so that as I talk, Mike, are you able to see my screen?
Sorry, Vinod, we can't hear you.
Are you able to hear me now? Michael? Michael, are you able to hear me now?
Still low. Your volume still quite low.
Okay, I thought I'd corrected it. Okay, let me log in from my phone for the voice and the presentation. I'll make it from here. Are you able to hear me now?
Yes, we're able to hear you now.
Okay, hope I'm not echoing. Oh, you are.
You are.
Am I echoing now? Michael?
It's good. It's good.
Okay. And my voice is quite clear?
Yeah, sure.
Very good. Okay. So sorry about this technical hitch. Though we are in a digital world, we expect it to be working as good as we are working as well. So morning, everyone, once again, and welcome to this webinar where MedSource is partnering to ensure that we are able to have better patient outcomes. So the value proposition that MedSource offers is it's a one-stop shop and normally in the world it's called a GPO. But what GPO means is, for those who don't understand the term or the context, it's a group purchasing organization where we aggregate orders from vetted customers and ensure that they are supplied through a legal supply chain, using vetted suppliers and legally imported registered products in the market. So this is basically what a group purchasing organization does. And MedSource, when we initiated it, it started off like a GPO model. And today we have a lot of innovations and disruptions that we have carried out in the market so as to benefit the market needs, sustain, and also ensure that all the demands of the industry in terms of supply chain of the products with assured quality are maintained. So a few details about MedSource. It's a private entity for profit, but being managed by a not-for-profit. And by that, what I mean is that as we ensure that we are doing business, we also have an impact arm that we need to take care of. And the ultimate goal or the ultimate aim for MedSource is to ensure that there is access of affordable, good quality medicines to patients in the last mile. So there are 4 or 5 key important factors that MedSource needs to be always aware of and be wary of, so that as we ensure that the customers, whom we call members, are content with the trading on the platform, so also is the patient needs and the patient outcomes being taken care of. So what MedSource does is we manage hospitals, clinics, dispensaries, pharmacies, stocking doctors, institutions in terms of their inventory and procurement management through an online ERP platform, which provides them the ease of visibility of different products from different distributors at different prices at any given moment in time. And they are able to do this all from even the comfort of their living room if they so wish to do so. So during the working hours, they're able to cater for the needs of the patient that visit their premises. And during the off or the non-working hours, they're able to place their orders and fill up their shelves or stock their inventories adequately enough so as to serve the next round of patients that they may get in their premises from time to time. So our ERP is, like I mentioned, a web-based application and it's easy to access. We have a lot of flexibility in terms of the searches. There's a lot of payment convenience that MedSource has provided on the platform, and we have a payment gateway integration which allows for multi financial institutions transactions or trading to happen without incurring or without adding additional cost to all these transactions. Our ROs will be approaching you in terms of trying to explain what we do in terms of the payment gateway and how we are able to benefit your business or able to allow you to run your business better so that you're able to serve the patients better. We have a wide range of products currently at almost 15,000 plus. Any hospitals, pharmacies, if you look at your product category, I don't think you have 15,000 products. We have 15,000 plus products so that we're able to cater for every need, every SKU that you may need to cater for while serving the patients. We have local manufacturers and imported distributors that trade on the platform. And these, why I must say that these are important, because we have we do not have middlemen that trades on the in the platform, and by that we don't incur costs, we don't create avenues for or loopholes for illegally imported products to be traded on the platform, and we definitely ensure that all the products that are traded are ethical and to the best of our knowledge are not counterfeits that are being traded on the platform. So we also are able to assist the chain hospitals or chain pharmacies where collaborative efforts can happen by way of having different levels of approvals between the headquarters and the branches. What do we see going forward as MedSource? Now, this is what I spoke to you about was in brief of what MedSource was existing. So going forward, we have a new project that we have embarked on. It's called ERA. So MedSource ERA or ERA. What ERA stands for is expanded retail access. And by that, what I mean is, as the member or the customer, for those who still are not able to relate to the term of a member, so as the customers continue trading on the platform, they also definitely stand to benefit in terms of getting leverages by way of discounted products, by way of additional benefits like rebates, loyalty programs, and a lot of capacity building. Currently the one that we're running is also a capacity building program with no cost or no additional cost added on to you. And we also have various financial institutions that we have pre-negotiated prices in terms of availing credit, but at a much lower interest rate than what you could get compared to the market. And remember, these are unsecured loans. By way, what I mean by unsecured is that it does not have a guarantee that you need to ensure or give to the bank. And also the facilitation or the process of vetting for you to get the loans is much easier and much lower compared to the normal trading traditional financial institutions loan and credit application and vetting processes. From the platform, we are able to get a lot of benefits out to you. One, I mentioned capacity. Second, I mentioned rebates. We also have a lot of data analytics, and we can only give you data information through our AI if you are able to trade on the platform regularly, show the purchases, and we are able to auto-generate an automated ordering system, tell you how you can order which product at what time of the year and what quantity based on your own trading history. So the more you buy, the more we are able to, the more you trade, the more you buy on the platform, the more we are able to help you gain better benefit of being on the platform. So this is what I spoke about. And we look forward to better engagement in driving patient safety. So our advocacy is always on quality assurance, and patients are served by competent health professionals. By that, we mean training, capacity building from our end helps to achieve this. We are also always wary of the fact that we only onboard fully licensed dispensers and health professionals onto the platform. And by that, we are able to have our own quality assurance processes and pharmacovigilance put in place through MEDS, which is the ISO 9002 approved laboratory. So with those few words, driving patient safety for better patient outcomes, I would like to stop here. Over to you, Dr. Michael.
Thank you so much, Vinod, for that introduction on MedSource. And for participants in the call, if you have any questions, you can post on the chat, and we'll have a colleague respond to all your queries about MedSource. We'll have a further engagement. If you want to understand more about MedSource, then you can reach us after this call so that we can explain more on what MedSource does and what it is. So allow me to take us now to the theme of the day. And just to appreciate that today we are gathered here as different players in the healthcare sectors and in different capacities. And therefore, in this industry, our ultimate customer, so to say, is the patient. And in different circumstances, we fall on different sides. Sometimes we are the healthcare providers, sometimes we are the patient. And therefore, it is imperative that we have good discussions around patient safety, because when we fall on the side of the healthcare providing professionals, then we need to ensure that patient safety is at the core of everything that we do. And when we fall on the other side where we are the patients, then we also need to ensure that our safety is taken care of. So today we are discussing patient engagement in the healthcare space for optimal patient outcomes. And we are going to look at certain key areas, and we are riding on 3 key areas. So what are these optimal treatment outcomes when we are engaging our patients? And who defines what optimal treatment outcomes are? And actually what really defines the quality of care, and what are the criteria that we can use to define what quality of care or handling the patient really is. So I don't want to speak more on this. We have a speaker today who's going to take us through all this. Allow me to welcome Dr. Odhiambo David, my good friend, Dr. Odhiambo David. Dr. Odhiambo is currently the Regulatory Affairs Manager, Novartis. He's a young man who wears several caps, so allow me to mention them. So he's also the curator of African Pharmaceutical Network. He is the co-founder of Reculture, Health and Social Innovation, and he's also a board member at the Kenya Association of Pharmaceutical Industries, CAPI. So, David, if you're ready, I would like to welcome you to take us through the session today to give us your presentation. Karibu sana, Dr. David.
Thank you, Michael. I hope you can hear me loud and clear. Let me know when you can see me as well. Hello?
Yes, David, we can see you.
Okay. Oh, actually, I'm seeing the camera is like it's not capturing the vision of it. Perfect. Now it's back. Great. So thank you for the opportunity and thank you everyone for joining us for the call. So for today, we are going to talk about patient engagement in healthcare for optimal patient outcomes. And as has been introduced, Odhiambo David is my name, a pharmacist by profession. I work with Novartis, but a disclaimer at the start of it is the views that I'm going to share are David and David as a professional working in the healthcare space, and actually a member of the public who at one point is a patient who needs to get quality outcomes and quality healthcare services. So based on that, then we can look into the conversation, and I would want us to start it from all of us. We are here today in this room. We have, I would say, 89 or so participants. When was the last time you were in a hospital and how was the experience? Can you reflect on that moment? What was it like? And that is something that we really need to be keen about, and we really need to reflect and ask ourselves whether when that moment happened, were you happy with the level of service you got? Were you proud of the engagement? Would you refer somebody to the same healthcare worker who engaged with you or to the facility where you got your healthcare services? It is important that we reflect on those engagements and ask ourselves if that was your case as an individual patient, as an individual, whether you are going to the hospital for your own needs or you are going to the hospital for and as the caregiver to another person. How was that experience for you? It is important that we reflect on that. So those are, I think there's background noise. Yeah. So that is a critical bit that we need to look at, and that is where we're going to start the conversation. So for me, looking at it from a patient engagement perspective, I had one bit that I got to realize that there's need for us to invest in patient engagement to a greater extent. And that was in 2017. 2017, I was still in the university as a student. And then, or definitely, you are a medical student, you are a pharmacy student, and everybody in your community believes you are the doctor of the family and the doctor of the village. So they would be calling you. In this case, it was my mother giving me a call to consult about a particular medical condition. She was unwell. She had gone to the hospital. So based on best practice, first order of treatment, empirical treatment to manage the symptoms. After managing the symptoms, they would be recommended to go for lab works. And when they go for lab works, when they go for their lab works and all that, then we are expecting that there will be a diagnosis, and from that diagnosis, they'll get the treatment that they deserve that is clear for them. That is the same case that what happened. She went for lab works, the lab tests were done and everything. After the lab tests were done, nobody took the time to tell her what she was ailing from. Nobody took the time to tell her of the diagnosis, but then she left the hospital with a list of medication that she was to buy. Going home, she doesn't know what any of the medicines are doing for her. She doesn't know whether she had the condition or not. And actually, what would be the next prognosis? How is she going to move on in her care journey? And the question that I was asking myself is, if these guys are giving you medication, for what are they giving you the medicines? Do we take time as healthcare providers and healthcare professionals in our lines of practice? One, when the patient comes, to engage them and understand what is it that really they're suffering from? And the other question is that comes from that same conversation is, doctors always know the answer. So as a patient, you narrate your case. Probably when you get into the clinic room, the doctor starts writing everything from where they are. And when they start writing, they'll only raise their hands when they're giving you either the prescription or sending you to the lab. And that is the reality of care that we have. So is that quality care? And if not, how do we go about it? Very important that we reflect on that. I see, Michael, your hand is up.
Yes, David, there is a comment that you increase your volume a bit.
Okay. Can you guys hear me now? Let me know if it's better.
Yeah, it's okay.
Okay, thank you. So with that said, I'll get into the presentation. Let me know when you can see my screen.
Yeah, we can see it.
Perfect, thank you. So patient engagement in healthcare for optimal patient outcomes. We all have to acknowledge that healthcare, basically, the aim is not to be able to treat people. The aim is to keep people and individuals healthy and when they are unwell, when they are sick, that is, they should be able to get access to the support and the care they need to regain their health. So the aim is for us to be healthy. Are we healthy? Definitely not. And that is why we have health facilities, we have healthcare professionals to be able to help us in that care journey, to get back to wellness, to get back to recovery as much as we would have wished for. And in that journey, patients are not bystanders or inactive players who are just a cog in the wheel, plugging in when they need it and plugging out when they don't. And that is critical that we have to acknowledge. Patients are our partners. If we are taking care of a patient, we expect that patient to get the services and the care they need. But after they get the care, we need them to get well. And after getting well, we need them to be a key stakeholder in the sense that can they continue living in a healthy way? Can they continue accessing additional healthcare benefits that might be of value to them? Probably they need, let's say, for example, to be part of a physical a lifestyle change program and all that. Are we engaging them on those frontiers? Those are critical for us to do. So knowing that patients have a critical role to do, some of the aspects that they can do, because when we look at healthcare service delivery and access to healthcare, we look at it across the continuum and across the spectrum as it should be. From the starting point where healthcare services have to be offered by a competent quality professional. And when people go to hospitals, they need to confirm that they're treated by the virtue that they have access to the medicines and the care solution that they need. So the medicines have to be of the right quality. Who will pay for those medicines? Who is providing them? And where do I access them? Geographical access, availability of the medicines, and access in terms of the patient being able to get to that facility and get somebody to deliver the care. So the different aspects that we look at would be, can the patient advocate for government investment in health? So because we need the investment and health is a social need and a government responsibility. So from that perspective, patients have a role of that. Patients have a responsibility to contribute to their health insurance schemes, whether it's the social insurance scheme by the government or private insurance schemes, because failure to which of having such, then they're not able to access healthcare services or might suffer financial hardships, which is not one of the principles of UHC. We need people to be able to access quality healthcare services without suffering any financial hardships. They need to be informed. That is the knowledge economy and the knowledge space that is moving forward. We need patients to be informed of their health choices, how they can stay healthy and how they can move that journey as much as possible. So, and in that case, then they're able to adopt healthy practices and include preventive and promotive aspects. When we look at vaccines, are the patients willing to take up vaccines and vaccination services? If not, why is it that they're not able to? As a healthcare provider, how can you engage them to enable them to acknowledge and adopt the practice, the scientifically proven evidence-based practices to be able to stay healthy and adopt these preventive and promotive aspects? When a patient is unwell, they need to seek healthcare services. Are they able to? If not, why are they not able to seek healthcare services? And when they come to your clinic, when they come to your pharmacy, when you come to the hospital, the patient needs to be able to engage with the healthcare practitioners in their care journey. One, they need to disclose their history of disease. They need to be able to understand why they're being given a particular set of medications. And once they've been given those medications, they need to understand, how do I need to use it? And that is a very important scope of what they need to look at in terms of patient engagement. But then if we looked at that is, who is a patient? And at this point, I would be glad to get some contributions from the audience. Who is a patient to you? Anybody willing to give it a try? Who is a patient in healthcare? Nicola was made to believe we're dealing with healthcare professionals today.
Yeah, yeah. I think the mics are disengaged. We can engage in the chat, but I see Julius has raised his hand.
Yes, Julius.
Julius, if your mic is enabled, you can go ahead.
It's okay. We can use the chat function for the time being. I think that would also be a good way for us to engage and move along. But you need to know who a patient is. And
is a
yes,
person who needs medical assistance from a medical profession.
A person who needs medical assistance from a medical professional. And thank you for that, Julius. Thank you. So it's somebody who needs medical assistance from a healthcare professional. Does it have to be somebody who is unwell? Or is it David, Michael, Julius in this room today? When you look at the WHO definition of health is a state of well-being and not only the absence of disease or infirmity. Are you socially, psychologically, physically well where you are? And what additional support systems would you need to be able to attain that? And that is a very important bit that you need to look at. Are you having access to the continuum of care from the promotive, preventive, curative, rehabilitative, and palliative healthcare services when and where you need them? And for me, when we look at patients, is each of us is a patient at one point, and each of us is a patient at any one point. The only difference is what kind of healthcare services do we need? And are we able to access them? And when we are accessing them, are we getting the support we need? A case example would be when you go to a hospital, when you go to your gym, and your gym trainer does not give you the time and you've been a subscribed member. Do you feel happy about it? Most likely not. But if you don't feel happy about it, the question you need to be asking yourself is, David comes to your pharmacy, he asks for medication, you give it and you let them go without knowing what was they suffering for. Why do they need the medication? How are they going to use it? Are you helping them and engaging them in their care journey? And in this slide, I had a couple of questions. And I think this is for you to reflect on and ask yourself, what is quality healthcare? Is quality healthcare what you perceive it to be as a physician, as a nurse, as a pharmacist, or is it what the patient perceives to be quality? And is quality the high-tech solution that we're integrating in our healthcare systems, or is quality the ultimate value that the patient derives out of it? Because as a society, there's some notion that we've had where we've shifted from looking at quality to be the kind of service that the patient perceives it to be, but rather what we perceive as healthcare providers, as facilities, as investors in the healthcare ecosystem. We need to define quality on our end. And as a professional, there is the scientific benchmark and standards of what you perceive to be quality. And therefore, that has to be met. But does that speak and correlate with what the patient expects in their care journey? And if that nexus is met, then we're able to say we are guaranteed that patients are getting the quality healthcare services that they need when and where they need them. And that is important for us to acknowledge. So defining quality, there is the quality from the patient and there is the quality from you as a healthcare professional, but also quality from the hospital or the healthcare facility where you're working, whether a pharmacy or a clinic. And we need to be able to engage together to make that a reality. And then when you talk about optimal treatment outcomes, what are optimal treatment outcomes to the patient? I came to you with malaria. You gave me medication, I got well and went back home. That would be optimal treatment outcome from a scientific rationale that David got healed. And therefore, that is success in treatment. But what happens when a patient comes to you in a vegetative state, leaves your facility, let's say David, fully functional, fully physically able and all that. has an accident, comes to the facility. In your treatment journey, David leaves the hospital amputated, in a wheelchair, not able to function normally. Is that optimal treatment outcomes? It is not my place to make that decision and that call. But the question is, what would be optimal treatment outcome? What would be the desire of the patient at the end of your medical intervention as a physician, as a nurse, as a pharmacist, as a pharmaceutical technician, as a medical lab person, whatever the background of your practice? Does it meet what the patient would have wished for? If it is not able to meet that, how can you close the gap from your end and also close the gap from the patient's end, so that at the end of the day, the final outcome is something that is acceptable for you and is acceptable to the patient, but they're also able to see, how do I cope with this? And that is where you'll see, for example, in the last case that I talked about, you'd be able to support them to heal from the accident and the injuries that are associated, the injury that they have sustained. But after that, you need to ensure that they have a psychosocial integration program and plan, so that that patient gets to accept their new state. They were high functioning individuals. Now they're not at that high functioning. What would be your role in helping them transition across that spectrum? If you're able to do that, that is what we look at as optimal treatment outcome, in the sense that the patient accepts and actually is in a position to move with the next level and the next phase of their care journey. And that is a very important thing that we need to look at. Quality healthcare, optimal treatment outcomes. There is the scientific bit that you look at as a healthcare professional, but there's also the critical component that is driven and supported by the patient who gets the services and who needs the services. You need to be able to work with them and walk that journey with them. And whenever you're looking at a patient and engaging with them, you need to reflect on this and see how that works for them. On this slide, I'm looking at the continuum of care. And I already mentioned some of these. There's the promotive aspect. You are healthy, you're just promoting health and staying as healthy as possible. Then there is the preventive. You are at risk and you believe you need to take an action to prevent yourself from getting the disease or suffering an illness and all that. That is why when you're crossing the road, you have to look right and left. You're preventing the risk of you getting an accident and suffering from it. That is why when we were born, we have the immunization programs. We need to be vaccinated and we need to stay as healthy as possible and prevent these diseases that are preventable. COVID-19 came. With COVID-19, we had to get vaccinated because we know the risks and we want to prevent it. Then when I am unwell, I get to the curative aspect. I need to be treated. I have malaria. I need artemether-based therapies to be able to get cure and to get back to functioning life. I'm suffering from drugs and substance use disorders. I need rehabilitative support maybe in inpatient or outpatient, but I need that rehabilitation, getting me back to where I was at my optimal functioning capability, including the case that I talked about after the accident. Can you get this person to be psychologically in place to continue functioning normally? Then we have the palliative aspect. End stage cancer patient, their final phases, they are dealing with pain management. Are you able to make the last days of this patient more bearable and more pleasant in their journey? And when you're looking at the continuum of care, then you ask yourself, and this is going to take me to the next slide, is where do you, as a pharmacist, as a nurse, as a physician, as a clinician, as a medical lab person, get into the care journey for that patient, and where can you engage the patient? Because the first one is the pre-primary, promotive and preventive mostly. Then you can have the primary component where the primary preventive aspect also comes in, where we have primary healthcare workers, community health volunteers, and all that, ambulatory surgery centers and all that. Then we have the hospital inpatient. Then the outpatient can be rehabilitative, home care, hospices, skilled nursing facilities. That is post-acute, the rehabilitative and the palliative care component. But when you look at all that, then where do you come in? And for me, looking at this is for you to identify where would be your intervention needed and where would you make the most impact. And it looks at what is a typical patient journey. At the moment, I believe out of the 100 people that we have in this room, there's somebody who is using medication that they did not really get it prescribed, or then using a product that they did not buy for a medical disease. They're not suffering from any disease, but they just want to stay healthy and stay at their optimum performance. And that is what we look at self-care. And even within this room, there are people who are reading literature about particular diseases, particular wellness programs, and generally even body care beauty products and related. That is where the self-care component comes in first. So if you are a beautician, if you are a pharmacist, you are a physician, you are a clinician, a nurse, to what extent do you support patients in their self-care journey? Do you give them information? And that is a very critical point that as the healthcare community, we need to look at as a critical area of investment, because we have more patients and more people generally in the society with a desire and interest in taking control of their lives. And that is where self-care is gaining prominence. But on that note, there are different unscrupulous dealers, or I would say unqualified professionals, who are vending and actually dispensing medical counsel and guidance, which is not within the scope of their training. I believe we've all had the stories about, I think it's Unipass or something. Those kind of conversations are happening. Is there scientific justification and rationale behind it? And why is it that they're getting more people than the facilities are actually offering evidence-based, scientifically proven principles of care? We need to have a touch point, and you need to evaluate and ask yourself, as a nurse, as a pharmacist, as a pharmacy technician, where can you touch into the lives of the patient? How can you make your scientifically grounded information get to the patient who needs it without risk? So the self-care component is the first touch point, and that is where we start all our care. Then after that, you feel unwell a little bit, most of the time because of the healthcare system, how it's structured and how the service delivery happens. We would go to the pharmacy instead of going to a hospital. So you'll go to the pharmacy, either buy over-the-counter medicines, buy some painkillers, whatever it is, you'll get that. If that doesn't work, you'll go back to the pharmacy and get advice. Now you are seeking advice from the pharmacy. If not viable, you'd be referred to a facility, or you'd just decide, I think I need to see a doctor now. You'll go to the physician to seek physician counsel and get the treatment as you need. If the physician, after empirical treatment, decides that you need to move further into lab tests so that we have a diagnostic justification for the treatment that you're getting, and the final diagnosis that is confirmatory, then you'll be sent to the laboratory for the lab tests. That is a critical bit. Then that is where you as a lab person, you'd ask yourself, how do you ensure that that quality is ingrained and actually integrated in the system? From there, from a lab work, you'll go back to the physician or the nurse. If nurse is mostly when you are hospitalized and you're going to stay in the hospital, you go back to the physician, you're admitted in patient care, and the medicines will be dispensed and delivered through that channel. Otherwise, the physician will write a prescription. You'd go back to the pharmacy. And at the pharmacy, that is where you'll get the medicine that were prescribed. You'll be able to be advised on how to use that medication and what would be the expected outcomes of it. In case there are any adverse events, how do you deal with them? If there are already side effects that are noted, in case there are side effects that were not expected, where do you report them? How do you report them? And those are the key components. So when we look at patient safety, pharmacovigilance related, as a healthcare professional, look at this continuum and ask yourself, where do I come in? How do I come in? What do I do in each of these phases? Or in which stage do I practice? What do I do in this area? How can I improve it so that one, patient need to come to you? Because when they don't seek care, they'll not get the care. And the quality of the care cannot happen unless it is delivered. So you need to ensure, how do I get them to come to me? When they come to me, how do I engage with them that they'll see the value of my service and therefore they get better at a personal level in terms of the physical condition, but also the psychosocial aspect of terms of them feeling they're getting better and they're getting relief from their pain and suffering. Those are critical bits. So why patient engagement? At this point, actually, it's about you reflecting and asking yourself, from the discussion that we've had, is it amazing? Is it something that you think is critical? And why do we need it? And I use this picture because when you look at this, if you are the healthcare provider, the nurse in this case, or if she's a community healthcare worker, and you're taking care of this child and she's smiling in such a way, definitely it warms your heart. The patient feels, if she's a patient, I think this is mostly for a picture, but if it is a patient, the patient feels like they're happy to be with the physician. Do your patients feel happy when they're with you? Do they feel confident that they're getting the care they need when they're with you in your hospital facility? Do they feel seen? Because the reality is, in life, we need to feel seen, we need to feel appreciated and engaged in our journeys of life. Do we feel seen? And that is an important bit for you as a physician, as a nurse, as a pharmacist, as a pharmaceutical technologist, as a medical lab person, and a clinician. See yourself. Are you engaging your patients? Do the patient feel seen? And why would you do it? And this comes to the last bit. What is the return on investment or patient engagement in healthcare practice. As a healthcare professional, we are competent. And if you're competent, you're working in a healthcare facility. For you to be able to deliver that care, you need patients to come to you and need patients to be guaranteed and have the confidence that they'll get the care for you. So what would be the value of your engagement for the patients? One, there will be improved treatment outcomes. They come to you because they know you're competent, you're using quality products from vetted and quality registration status and licenses as necessary. So that is one bit. Improved treatment outcomes for the patient because they're getting quality from a qualified person who delivers the best care they can. From that treatment outcome that are better, they have better quality of life as patients and also to the community that they are dealing with. Because if I come to a clinic and I know that I got the best service, anybody from a family who is unwell or who needs care, I definitely refer them to that clinic. And they'll get better because we have the confidence that that facility is offering quality services. By the virtue that patients come to the facility, there's going to be early diagnosis for diseases. They don't have to wait to the long-term outcomes of it. They need to start the care journey early, which means the cancers that we're talking about, the non-communicable diseases that we're all talking about that we have late diagnosis will be a thing of the past because patients have confidence and trust in the healthcare facilities, and therefore they're able to come early, they're able to be diagnosed early, and the interventions can be instituted as early as possible. And therefore, we are reducing the disease burden from some of these conditions. And the promotive and the preventive aspects of care will be adopted at an early phase. The other bit is from a facility, your service is when people come to you. If you are having better quality of care, you'll definitely get referrals. And those referrals are a business opportunity for you if you're looking at it as a business, but also an opportunity to serve the communities and the people that you're offering care to. So that is a critical bit you need to look at as well. Are they able to come to you? Reduce morbidity and mortality. I think that is given. When people are getting the care, they don't have to take sick days off. They don't have to be hospitalized and all that. Therefore, they are functioning and optimally be productive in their spaces. But also we reduce the chances of people dying of diseases that they do not really need to die from. The preventable and curable diseases will be addressed in an early moment as necessary. And the other bit is in terms of improved facility earnings. For you to be sustainable as an organization, you need to be able to see what are the alternative revenue streams that you have as a facility if you look at patient engagement and the quality of outcome that you need. If you have the best service level, if I come from that region and that locality with easier access, I'll choose your facility to be my primary care facility of choice, outpatient care center, which means through the government rebate system through NHIF, all my capitation would be coming to you. But if it's coming to you and I'm already almost always healthy, then it means that money for me, I'm not using it. But it's helping you in terms of resourcing your facility to be able to offer more quality outcomes and more quality care along the care journey. So it might not be in the immediate, but it's helping you now generate that revenue from people who have confidence and believe in you. Two, when you're offering quality services and you're getting people healthy, most insurance organizations and insurance facilities would definitely want to have you as one of their service providers in their panel. Why? One, when people come to you, they get the quality care. Nobody wants to have an insurance cover that they know they cannot get quality services for. And two, as an insurance organization, they believe the return is in terms of most of their patients staying as healthy as possible. And therefore, they don't have to incur the claims. You're offering quality care services, meaning as much as you're offering quality care, most of the patients who are covered by them who are coming to your facility are not going to fall ill. And even if they do, there'll be minor issues because they are being addressed at an early phase. They are not getting into complications, meaning you are good for business, lower claims, you're good for their business insurance, and at the same time you're able to do your work and do your services. And that covers a cyclic aspect in the sense that when you have an insurance cover, more patients who have that cover would want to still come from you. So it is a promotive in terms of the brand equity that you've developed, the quality of service you're offering, and you need to look at it as patients as partners in your care journey, and you as an enabler and a support system for them to be able to get the quality outcome they're hoping for and to support them and walk the journey with them across the care system. And that is the end of my presentation for today. And I would be glad for us to keep engaging, keep having conversation, and ask ourselves, how do we challenge ourselves in the spaces where we practice? How do we challenge ourselves in the different organizations where we operate in, so that we're able to serve our patients better, but also able to ensure that we have a healthy and prosperous society that is going to be functional, going to help us achieve our aspirations in our practice setting, to be fulfilled in it, but also in our organization to be able to be sustainable in terms of generating revenues and incomes for our organizations, but in the service of humanity as patient level. With that, I'll hand it over to you, Michael, unless there are any questions.
Thank you. Thank you so much, Dr. Diambo David. Thank you for the enlightening presentation. So at this point, I would like to give around 5 minutes for any questions directed to the speaker or any further clarifications needed from the participants in the call. So if you have any questions, kindly just raise your hand, or you can quickly type it on the chat box or the Q&A space. So in the next 5 minutes, I'll allow us to do so. Kindly unmute everyone. Okay, I see a hand raised. Neville, kindly go ahead. Neville, you're unmuted. You can go ahead.
I think he's still on mute.
Okay, anybody else with a question or a clarification or a comment? Something you feel maybe the speaker has left out and you may like to add? Okay, go ahead, Neville. Or Julius, you.
Very informative information we have learned today. I want to believe that there's some places that we are not captured well. Hope we are going to take it seriously and help our patients get the information that they require so that they can have what we call optimal outcome as we have learned today. Thank you, Doctor, very much for this information. Thank you.
Thank you. Thank you so much, Julius. Thank you for those commenting on the chat box. Thank you. Okay, if there are no any other questions, I believe when there are not so many questions, it means the session was good. Dr. Kusu, I see your hand is up. Kindly. Yes, Dr. Kusu, go ahead.
Thank you, Dr. Michael. Am I audible?
Yes, yes, you are.
Oh, great. Thank you and congratulations to Vinod, David, and the MedSource team for starting us up with this conversation on patient engagement in healthcare. for optimal patient outcomes. Just to comment the great presentations and also the conversation around us putting the patient at the center of what we do. May we be the nurse, the lab technologist, the pharmacist, the doctor. And in line with this year's theme, I would really want to urge all of us, whether we are in offices, at the pharmacy, in a hospital, to elevate the voice of the patients. And in doing so, really ensuring that we bounce back to them to enable them to voice their concerns, their level of understanding, in ensuring that they adhere to treatment, whether it's the preventive, whether it's the lifestyle change, in ensuring that we also understand what concerns they are, in ensuring that we tap into their side effects or, other concomitant diseases or treatment that they are taking, so that then from our different perspectives, we are also able to, align the counseling, align the treatment, align the advice, and elevate the opportunity for better health outcomes. So thanks, and back to you, Dr.
Thank you so much, Dr. Kusu. There's a question here from James saying, in order for the healthcare system to be effective, how do we come up with a central electronic health record system in order to have optimal patient engagement? David, I don't know if you would like to take a quick shot on that one, and anybody else who might want to comment on the same.
Okay. Thank you, Michael, for this. And thank you, James, for bringing it up. I think having electronic record systems that are actually integrated is critical for us in terms of ensuring we promote evidence-based care, but also have visibility. Imagine if I'm from Siaya County and I'm now in Nairobi and all my medical records are in Siaya. It means when I'm unwell in Nairobi, that medical information cannot be used, and the history is important as from our medical practice and all that we know. So I think having it in place, it's a good conversation. It's something that has been discussed in different forums and different engagements. The question is, where does it start and how does it move forward? And two, is there options for us as all organizations that are working in this frontier to start looking at, even might not be having the same medical record system, but are they interoperable that we can say, if I'm using system A and system B, they can communicate to each other, and that the information can be transferred to the other entity. That would be a good bit. But I also believe from what you guys are doing with MedSource and even having a common platform would be a key for the membership. And also I think that would be something you'd talk about and see how that moves us forward in terms of having access to the information, but also supporting the flow of that information to ensure we have evidence-based conversation and healthcare interventions in our practices. Yeah.
Thank you. Thank you so much, David, for that. Vinod, I see your hand is up.
Yeah, hope you can hear me.
Yes.
Okay. So, James, it's a good question, and it's good that we are all progressive and forward-thinking. For the benefit of you and the question that you've asked, and for all on this call, there's actually a digital committee on health that has been set up and is looking at this. Currently, there are 3 hospitals that are already in a pilot project phase in terms of digitization of the entire data. Though cross-sharing across county has not been tried yet, but I think in a few months' time, probably even before we start the next year, we should have this pilot up and have reports coming out of it. This I speak from my experience and my exposure to being the director at Kenya Healthcare Federation, and I'm part of that committee as well. We're trying to digitize all records so that, exactly as like David mentioned, and many of us know, that one patient, when he's traveling, he doesn't need to carry a whole lot of bunch of files, and including prescription, which we may have lost in transit or may have lost along the line of the treatment regime that he was following. He just goes to a pharmacy and picks it up. But all this is trying to be digitized, and very shortly there will also be mask data of the patients, so that the government is able to effectively engage with different entities in terms of the treatment regimes, and also trying to set up ease of monitoring mechanisms in terms of the disease patterns in the country. So there's a lot happening. Probably in one of the next sessions between David and Michael, I think we could also sensitize our members or our pharmacists in the country of all that is happening in the digital and data space. Over.
Thank you. Thank you so much, Vinod. Any other questions or comments? Yes, Dr. Kusu, karibu.
Thank you, Dr. Michael. And Vinod, if you can allow me to just chime a bit on the electronic systems. So beyond the national level interventions, I was just thinking as a provider, in my small space, whether it's in my clinic or in my pharmacy. And actually, when we have the electronic systems, they actually enable us not just to dispense or to manage the patients or to even recommend, ask for lab tests for referral to the labs and vice versa. But you are able to also be able to utilize that system for management, for tracking the history in care, for picking some of the red flags, but also from a pharmaceutical side of things, you can also see the medication history. You can see the drug interactions. You may be able to actually utilize those good systems to actually track patients that are on chronic care. So from an individual perspective, I think it's also good to motivate us to go electronic in small ways, because beyond the patient management, we are also able to manage our resources, track the inventory for inventory management, and also it enables you to be more efficient and effective in resource utilization. And you can also utilize that for ordering of the medicines, budgeting, planning, to mention but a few, to ensure that at the end of it all, you're also getting cheaper quality, cost-effective medicines and medical products that, again, you can also pass on the better priced products to the patients, making them at the center, making them cheaper, and also ensuring that, we are monitoring the other adverse events and other safety concerns. Thanks, and over.
Thank you. Thank you so much, Dr. Kusu. And I hope that is well noted among all of us. There's another question here on the comment section. And this, I think, is directed to you, David. What is your take on the idea of community health promoters? I believe that is community health workers. And what is their impact on safety, on patient safety?
Thank you, Michael, and thank you, Paul, for this question. I think the government move towards looking at engaging community health promoters is focusing on where do patients have access to healthcare services. And some of it is informed by the data that we're talking about, in the sense that there's been a confirmation, or actually the evidence is pointing to the fact that most communities and most people are not going to the facilities as much as possible, and we need to keep people healthy as much as possible, but also engage them within the community level. So primary healthcare is a cornerstone of ensuring that we achieve universal healthcare coverage, and that is the basis upon which the government is looking at it. So it would help us, one, in ensuring more patients and more people generally from the community level are able to seek and access the healthcare services that they need. That is one bit from a promotive perspective. Then in terms of the healthcare access and delivery component, there's the delivery of healthcare services. And I think this is also a conversation that is looked at from all the other intertwined complex issues that are looking at it. For example, if you have community health promoters dispensing antimicrobials and related, is it going to increase on the burden of antimicrobial resistance and related? How does that impact care generally? So those are kind of complex aspects that we need to look into, and we need to ask ourselves, what would be the risk and what would be the best practice? In my perspective, we really need to have community health workers and community health volunteers, and that would be a key bit. The only question we need to ask ourselves is, what is the qualification to be a community health volunteer and a community health worker? And some of the work that we do through the initiative, actually you mentioned in Mike, agriculture, health and social innovation, is to see we have a very qualified and trained healthcare workers in the country, from clinical doctor, from medical doctors to the community volunteers and pharmaceutical technologists, lab technicians, and all that. They have the medical background. They are unemployed. Can they be repurposed and used as community health promoters and family physicians within the community level to ensure that we have fast, competent, and qualified professionals who are offering the quality services and promoting the primary healthcare agenda, rather than getting untrained people and looking at position them to do the promotion? So those are the alternatives that we need to look at. Yes, we need the primary healthcare workers, community healthcare workers to integrate and offer services at the community level. The question is, who should it be? What is the scope of service, and how do we ensure it delivers the ultimate outcome that we wish and aspire for, that will ensure people have the care they need, they have the quality that they deserve, and ultimately the government is able to achieve its mission of UHC. And that is all our mission as members of the healthcare fraternity. We don't want our people to be unwell. We need them to all be healthy, and when they're not, to be able to get the service that they need. So that is what I would look at it from that perspective, Paul. But I'm open to have other suggestions and contributions from the team as well.
Thank you so much, David. Quite an interesting perspective. I don't know if there are any other comments on the same from the participants. As we wait, there's another question here. And I think this is to for those in the retail sector or on the different spheres. So Dickens is asking that, how do you cope up and manage these patients that trust in your service but don't want to incur some costs in your facility? They keep consulting your services and insist that that you recommend for them the preferred medicine, but end up sourcing the drugs from another facility. David, would you like to comment on that, or anybody else?
Well, I would say, one, it's an interesting question, and it's an interesting reality of the retail business and retail space where you practice. And for sure, it happens. So the question would be, what would be your, maybe you'd look at it from restructuring your revenue model, and you'd see what are the different business propositions that you could have. You could have consultancy services. That would mean now you're offering the technical knowledge as a professional on that line. And therefore, whatever it is, whether they buy the medicine from you or not, they would still have paid for the service that you're offering, because it's a professional expert opinion. I don't think there's ever a day that you as Michael, you as Dickens have ever gone to a lawyer to seek any service or even get just a letter of undertaking drafted for you that you get it for free. So you need to look at those perspectives as well. So if that is it, because at the end of the day, your business needs to be sustainable. You need to see how do you make it sustainable. So there would be a service for that, but then you'd make it like for those who are getting to buy their medication from you, you could say it's going to be free consultation, but they pay for the medicine that they're buying. Then you have a clear charter of services that you're offering. That would give you away. Because one thing that I know, and I think this is where the basis as to why they would come to you to get the service and know which medicine they need to buy, but go to another wholesaler or retailer, because those other dealers are getting these services in bulk. Therefore, the economies of scales are favoring them compared to your retail pharmacy where you're operating. So you cannot sell at the same price, but they're looking at the price advantage for them to go get it somewhere. So you just need to, I think that would be the best thing. Review your business model and see what are your revenue streams as a business to be sustainable. Yeah. But I'm open to other perspectives and suggestions as well from the team.
Thank you, David. I think as healthcare professionals, we've all gone through a similar experience, especially those that come on WhatsApp and say, Daktari, a quick one. So I think we also need to see how we can charge those as well. Anyway, I think time is well spent. If there's any other burning question or an issue that we may need to address. So if a participant has any other burning question, we can quickly address it as we close. Okay, silence means that we are good now, and most have been covered to our satisfaction. And so, ladies and gentlemen, allow me to bring to an end this session. And I'd like to say we are coming to an end of a discussion that has been quite enlightening. And we've so far delved deep into the importance of patient engagement and how it impacts the overall quality of healthcare, which is a discussion that should be ongoing. And just key to note from a few areas that the speaker had pointed out is that patients are not just mere bystanders or inactive players in the healthcare space. They are critical in defining the quality of care that we need to provide as professionals and also what they expect as patients. So in the clarion call is that as we look at the continuum of care, promotive, the preventive, the curative, the rehabilitative, and the palliative aspects of care, the clarion call is that as service providers, we need to build quality in our services at all these stages. Another key thing that has come out in this call is the importance of harmonized healthcare records and how we can use this data to improve the care we provide at all the stages of care. So at this point, I would like to encourage all of us to continue with this conversation. So as we conclude, let's remember that patient safety and well-being is a shared responsibility, and it requires commitment and collaboration across all the sectors in the healthcare space. So the knowledge we've gained here today should just not remain confined in this virtual space, but it should inspire actions and initiatives in our respective roles and organizations. So I encourage all of us to continue this conversation, take it further, and let's engage in different forums in different sectors to drive the patient safety agenda. As MedSource Group, we are committed to patient safety, and we are participating in a sector where we are ensuring that we provide access to quality and affordable healthcare products, which are again key in the patient safety space. So on behalf of MedSource Group, I would like to, first of all, extend our sincere gratitude to Dr. Thiambo David, who was our panelist in this session. I would also like to thank all the participants in this session. It's been quite engaging, and I hope that we have good points to take home. And for those that helped in putting this together, the MedSource staff that helped in putting this together, I would like to extend my sincere gratitude to you. So as we commemorate this Patient Safety Week, so as MedSource, we had organized these webinars. So we have another second webinar coming up tomorrow. And tomorrow we will be discussing how do we build a culture of safety to minimize patient harm and medical errors. So this is also key, a very key aspect when it comes to healthcare provision that we need to discuss. So kindly join us again tomorrow as we tackle that session. We will have another speaker who will take us through the session. So we will also be providing certificates for all the participants in these webinars, and also for the healthcare professionals in this meeting. There are 2 CPD points. You can log on to your different professional portals, and you will be able to get those 2 CPD points for each of the sessions we will have. So, ladies and gentlemen, thank you very much for joining us today. Allow me to end the session at this point. Have a lovely day. Thank you.
Have a good one. Bye, everyone.